Guys, we are live. Okay, cool. Okay. All right. We are talking about liposuction. My shape lipo. Today was a procedure day for me. We sucked a bunch of procedures that some larger individuals took the whole front of the face. Took off a huge number of huge amount of fat. I was thinking of the number of liters that we took off. We took off about 5 liters off of each one of these individuals. So let's see. See someone on Instagram saying they're ready for round two. Hey, so today, kind of cool if I could bring someone on, either on FaceTime, to talk, someone like previous patients. So if any of my previous patients are available, so just let me know if someone wants to pop up. And on Facebook, I have it. It's saying swipe to reveal the comments. That's odd. Okay.
Not as of yet.
Cool.
Megan,
All right,
is there?
there we go. Okay, so is there restriction? So it's a great question. A lot of people are wondering that, and so with my shape lipo, we don't do any weight restriction, BMI restrictions. So this becomes important for our a little bit heavier, and you're trying to get liposuction. Plastic surgeons, they same thing. They have weight restrictions. They want you to be your ideal weight before you do any liposuction. So when you're larger, they'll typically turn you away, or they'll force you to do something like a tummy tuck, or other more restrictions, no BMI restrictions. So if you have fat that you want removed, no matter whether you're 100 pounds or you're 350 pounds. All right. Hope that made sense. The reason why, people are asking this question about the weight is just that, most doctors, the in the industry, it's been basic that they say that it's ideal to be your ideal weight before getting liposuction, and not out with smaller liposuction. They use exceedingly long, so like the size of the thickness of my finger, like they're huge. And so when you go through there, if you can imagine, it's taking out so much volume that it would literally it would carve out, indentations into the skin just by going through. So the results were not very good, back in the days when they used larger instruments, and because of that, they couldn't be as aggressive and get as much fat out. So they were not very aggressive. They would stay real deep, and away from the surface, so they wouldn't get that much fat out closer to the surface. So the results were mediocre for most surgeons, and people accepted that for decades. But things changed, and the type of instrumentation that we use has changed. We actually use much smaller instruments, that take out, it's with each pass, it's taking out less fat. However, it doesn't create that tunneling effect that the old larger instrumentations did. So, with the smaller instruments, you can go in and get very close to the surface of the skin without having, being concerned of causing defects. So it's made it much easier to get a lot more fat out and be much more aggressive while getting smooth and even results. So it's pretty phenomenal what we're able to do at this point. Um, so no weight restrictions. How long does it take to see results? The results are actually instantaneous. I mean, it's so the fat, once the fat's removed, it's everything's smaller immediately, and you'll see the results immediately. In fact, as I'm working, you see things getting smaller and smaller. With that said, there is going to be a healing process. So the process of removing the fat causes damage to the body. So it causes trauma, breaks blood vessels. So it's somewhat traumatic to the body. So there's a healing process. So your body will heal, and there's certain things that it will do for a period of time after the procedure. So until you're completely healed, you won't see the final results. However, the result, as I said, you're gonna see the results of it, and that you're gonna be smaller immediately. It's just the final results occur after all the healing has happened. Now, all the healing process, initially we're expecting that you're going to get some swelling. So you're going to get some swelling. Your body's natural response is to swell up. So we put compression garments on. So we want to compress the area to try and reduce the amount of swelling. You're also going to get drainage of the fluid. So since we're doing this under local anesthetic, we use a lot of local numbing fluid. And that fluid, some of it comes out with the fat, some of it drips out during the procedure, but over the next few days after the procedure, it'll continue to drain out of the added holes that we create to get the fat out. Now, we want it to drain out. It's imperative that the fluid comes out of your body. If it doesn't come out of your body, then your body has to reabsorb it, and that tends to take longer. And your body has much more of a challenge to absorb those fluids. In fact, what I've found is that people that drain less tend to swell more. So that fluid, if it stays in your body and is not able to drain out, those people tend to swell up quite a bit more. And the people that drain a whole lot, and the ones that complain like, oh my God, I'm draining so much, they tend to swell very little. So you really want to drain a lot. That's ideal. All right, with Smart Lipo, what's the most fat you have taken out of an abdomen area? So Tawana, it's Smart Lipo doesn't make it easier per se to get the fat out. In some situations it does, but I get out a lot of fat. I'm very aggressive, regardless of what we do. But how much fat I get out, it's really for you. All you're really concerned about is for you. You want to get it out as much fat as possible, and I am very aggressive. And as I was saying earlier, with the smaller instrumentation that we use, I'm able to get much more aggressive, get more fat out closer to the skin while keeping smooth and even results. And you see from this picture behind me that this. We can get large volumes of fat out of there and make a huge dramatic change in a short period of time. So it's pretty cool. We are located in Las Vegas. About 70% of our patients are flying in from out of state. So Denise, we've made it really easy to get out here. We've also made the whole process of consultations much easier. The consultations can be done over the phone with the use of pictures. So through our website, you can click and schedule your free consultation, email us pictures. We try to make the process really easy. Mary Lee said, if I'm 300 pounds, that's great. That gives me more fat to remove. We make bigger changes on people that have more fat to remove. That's a lot of these pictures you're going to see behind us are larger individuals where we can make a bigger, more dramatic change. So absolutely, 300 pounds, we can help you out. Now, you have more fat, which means that we may have to do multiple procedures to, address multiple issues and problems that you have. You're going to have more problems the heavier you get. So just, be aware, but I can absolutely help you wherever you have your problems. Okay, can you do arms after weight loss? Absolutely, arm liposuction is a great procedure. We do lots of them, and it doesn't really matter before weight loss, after weight loss. It's all up to you. Now, the arms will typically have those issues with the skin hanging. However, the skin retracts back quite nicely with the liposuction. And if you look at some of our pictures on our website, maybe some pictures will pop up as I'm speaking here, but the skin will retract back quite nicely, and I think you'll be surprised at how well it tightens up after the procedure. A lot of the problems with liposuction come when with gravity, with the volume is hanging down, so it'll pull down when you have volume. So now when you take that volume away, it tends to bounce back up. and it's all about gravity. Gravity is pulling down on that heavier volume, and so when we eliminate that volume and eliminate that weight, the skin will bounce back, and you'll get much tighter results. And that happens on everybody. It's not just one person, or I'm guessing, or maybe it might happen. It happens on everyone. The question is just how much will it tighten up? Everybody's a little bit different. You know, you if you're older, like say you're 70 years old and you have loose skin, you know, thin hanging skin, it's probably not going to tighten up as well as a 25 or 30-year-old. So you got to be realistic with what's possible for you. Um, Alternative for arms is getting the arm lift, which is a horrendous procedure. Is where they actually cut the skin away here, and you get a big scar that goes from the elbow all the way to the armpit. It's a terrible procedure. The scars never look good. The results are mediocre at best. If arms are the issue for you, I would highly recommend you try liposuction first. You'll probably get the results you're looking for, and if you don't get the results you're looking for with liposuction, the last ditch effort would be an arm lift. But once the fat's been sucked out, you're going to get much better results with an arm lift. So try the liposuction first. Okay. Jesse asks, do we have a recovery room after the procedure, and how long is it recommended? And is it included in the cost? Yes, we have a recovery room. So our costs, just so you understand, include everything. There's no additional costs unless you want to buy extra garments or things like that. But you get everything. We're gonna give you a garment. We're gonna give you supplies. We're gonna give you the recovery room. All that's included. Follow-up visits. All that's included. There's no extra cost. The cost that we charge, that's the cost. So I don't like being treated like crap as a consumer, so I don't want to treat you guys poorly either. So we're going to give everything up front and try and make this make sense for you. Denise, you need my help. All you have to do is schedule a consultation. That's the next step. Brenda, you say you need fat transfer. It's a great procedure. Fat transfer to the breast is very popular, but the butt is probably the most popular. Denise, sorry if you may have clicked off. The cost-wise, so the next step, if you're ready to move forward and you're ready to get the liposuction procedure, the next step is getting your consultation. Our consultations are free, as I was saying. Most of our patients are coming from out of state, so the consultation process we've made very simple, where you can email us pictures. You can also schedule your own consultation time. So if you go to our website, you can click on the links there to schedule your free consultation. MyShapeLipo.com is the website. Melanie, you do not have to lose weight first. Come as you are. So when I say this, that you don't have to be your ideal weight, it's not. I'm not saying that you can just eat whatever you want and be fat and then come here and get your fat sucked out. That's not what I'm saying at all. What I'm saying is that in order to get liposuction, say as soon as you've made that decision that you want to change, that you want to make a difference in your life, that you want to change your lifestyle, change your patterns, change your habits. When you're ready, you just go ahead and move forward. Get the procedure. I'll suck the fat out, and then you got to stick with the habits. You got to stick with the healthy eating patterns. That's what's going to get you the long-term results. That's what's going to get you the best results. If you stick to the healthy eating habits, you got to change your lifestyle. But the cool thing is with liposuction is it gets you that head start. It's like a Kickstarter. It gets you out of the gates here, and you can start running, start moving, start seeing results. So you're gonna see the results quickly with liposuction, which is the best part, because when you start seeing the results, it starts getting a lot more exciting because you believe that it's possible. And so that's what I want you to do, is you need to believe that it's possible for you. If I can remove a large volume of fat off you, make you substantially smaller immediately, it's up to you. You got to keep working hard for it. You got to keep eating right, exercising, but I'll give you that head start. I'll help you to see the results. I'll help you to feel better about yourself quickly, so then you can keep it up. My patients, if you look at some of our patients that follow us on Facebook, um, a lot of them say that this procedure has given them that confidence that they need to really stick to their diet, stick to their exercise program, and get the best results. And ultimately, it's all about being healthy. Like, so what if you look good but you die when you're 45 from diabetes or from a heart attack, or you know obesity leads to damaging your joints, and you need to get a hip replacement or a knee replacement at such an early age. Like, this isn't just about looking good. This is about feeling better about yourself, about being healthier and living a healthier lifestyle. That's what this is about. Now, if you feel better about yourself, if you have more confidence, that's going to reflect on every aspect of your life. And I think that people, they believe that this is just like a cosmetic procedure, and that can be the farthest thing from the truth. Liposuction is so much more about confidence and the ability to do the things that you want. Because most people, look, when you're overweight, you don't feel good about yourself, you have a hard time fitting into your clothes, you have no energy, you don't feel like doing anything. And when you don't feel like doing anything, your life is just wasting away. Time just passes, and next thing you know, you realize it's a decade later, and your kids are bigger, and you're like, I've been doing the same thing for a decade and nothing's changed. And not only that, your health has gone downhill. So when you're ready, when you see this stuff and you're like, man, this is bullshit. I'm sick of living this lifestyle it's killing you. It's like a slow death. So when you're sick of living that slow death and you're ready to change, liposuction is that jump start. It just gets you going, and it makes you feel better about yourself. It gets you smaller. You'll fit into your clothes. You'll feel healthier. It's like it gets you going, and then it's up to you. You got to live that healthier lifestyle afterwards. All right, back to some questions. Is arm lipo cheaper than stomach lipo? Jasmine, we charge per area, so it doesn't really matter where the area. However, the abdomen is multiple areas. So go to our website, check out the free consultation, get your consultation. We'll give you an accurate quote based off of what you're looking for. So if any of these any questions that you guys may have about price. Our prices, first of all, our price list is on the website, so you can see it, but I don't know exactly what you want, so I can't give you, definitive prices on what things are. Also, when you're larger, the areas are not, they're not the same as smaller people because you have more of everything. So, get the consultation. That's the first step. Clarissa, I don't do tummy tucks. Don't recommend them. Most of my patients are trying to avoid tummy tucks. So if you're trying to avoid a tummy tuck, I'm your man. Let's see. Tawana, I really need this smart lipo. Send me a link for financing. I already have had my consultation. Tawana, I'm sorry. I mean, that's not my job. I don't send links to people. One of my team may be able to do it, but if you've had your consultation, you need to contact Brandy, who did the consultation, and ask her about the financing so we can get you set up on the financing, because I don't know if it's just a link. I think you need to get things set up. So, but please call the office to check into that. I see. Amanda Savage says, is lipo safe? I've had the gastric bypass and 2 C-sections. So absolutely, lipo is safe. Particularly the type of liposuction that we do is it's called tumescent liposuction, where we do liposuction under local anesthetic. And I have many patients that have had gastric bypass and many patients that have had C-sections. It's not a big deal, so I can definitely help you. What would be the average cost for BBL and 360 lipo? Mariah, again, it just depends. I don't know if you're 90 pounds or 350 pounds. So I can tell you the liposuction per area is $12.99, and the fat transfer for that process is $2,000. So it just depends on how many areas that you need. For the 360 lipo, at minimum, you're talking 5 areas, and it could be more depending on how big you are. see. I had my legs done, and sadly they took only a tiny bit. I came out looking like nothing was done. Let's see. Yeah, so it looks like Megan had a bad experience with another doctor. She didn't do her research, she's saying, and had bad results. They simply just didn't get enough fat and left lumpy results. So that's a shame. I have a lot of people that tell me, especially those individuals from small towns where uh, there may be a plastic surgeon in your town, but if they're not busy, there's no way they can be good. It's just not possible. So I mean, this is something that you have to practice. And so the big advantage of coming with me at My Shape Lipo is that this is all I do. All I do is liposuction. So um, I'm doing 4 procedures a day right now. In the past, I was doing 10 procedures a day, 5 days a week. I mean, like ridiculous amounts of procedures I've done. Ridiculous. I mean, thousands and thousands of procedures. So I've gotten way more experience than honestly, I haven't met a single doctor that's got even close to amount of experience that I have. Even the doctors that teach the courses, they have not even close. Like it's not even a close comparison to how many procedures that I've done. All these plastic surgeons and these ones they're trying to claim like they're as better than me, or like why would you go to My Shape Lipo? He's not a plastic surgeon, but none of them even have close to the amount of experience that I have. So when you're considering this, just realize that it is possible to fuck it up. It's possible to get crappy results with liposuction. So if you don't know what you're doing, or you go to the cheapest guy that you can find, or you go to just the local guy that's around you just because he's local, like you can get bad results. It's possible. And if you get bad results, that you need a revision, which means that you need to get it done again. And I don't charge less for revisions. In fact, I should be charging more because it's more difficult. I do lots of revisions. I do lots of these procedures where patients go to other doctors. I got lots of people that go to Mexico and Colombia and they get crappy results and they come to me to fix it. So it's all your choice. Look, I'm not forcing anything on anybody, but it's your choice. If you want to get things done right, then you go to the person who does the most of them. That's hands down. Um, this is, you look at any other industry, any other sport, any other business. I mean, anything. The people that do the most of whatever it is, whether it's if you're playing basketball, the guy that shoots the most free throws, he's gonna be the best at shooting the free throws. The guy that plays soccer the most every single day for 8 hours a day, he's probably going to be the best soccer player. The guy that is a mechanic and he works on a specific car 12 hours a day for the past 15 years, he's probably going to be the best at that car. So like the point is that me specializing and doing only liposuction has allowed me to get great at liposuction. Not just okay, not just, we don't just get good results. We get fucking awesome results. And that's what I'm going for. The best, the best, of the best of the best. That's my goal, is to be the best of in the world. I don't want anyone to be better than me. And when I hear people talking like they're better than me, it pisses me off. So I want to be the best. And if you want to get the best results, then you got to go to the people that are trying to be the best. And so um, it's not necessarily the guy that charges the least. It's not necessarily the guy that's around you. It's the one that's doing the most. It's where the people are going. It's the one that has the most exposure. And unfortunately, advertising is a big part of getting exposure. So I know there's a lot of surgeons out there that are not great advertisers, and they may be the best surgeons, but if no one knows about them, then it doesn't really matter. So um, it's important that whoever you go to has a great reputation. They have plenty of previous patients that you can talk to. They have pictures that you can see. They have reviews. You got to have everything. You don't want to go to the guy that just got licensed. So I mean, that's when it's like a recipe for disaster. Let's see. How long do we stay in town? Sarah Rivas. So, staying in town, my recommendations are to fly in the night before the procedure, to make sure that you get to your procedure on time in case there's any delayed flights or whatever. So, fly in the night before, get your procedure the following day, stay at the hotel that night, and you can possibly leave the next day. However, it would be better to stay one more night. So a total of 3 nights would be ideal. 2 nights would be minimum. Now, I do have some people. This is my recommendations. However, I believe anything is possible. So I know there are people that like to push the limits. It is possible to fly in the day of the procedure and leave the same day as of the procedure. However, I don't recommend it. Those type of people tend to get have a higher risk for problems to occur. They have more complications. And they tend to have more problems. So it's because they're trying to do too much too soon. So it is possible for those things to happen. However, I would recommend staying for at least 2 to 3 nights. What's the follow up? We don't require you to come back in for follow up. So particularly the ones that live out of state, we don't require that you come back for follow up. All the follow up is done through phone and email. However, if you're in town and you want to be seen, absolutely, it's free, it's included. Come on in, we'll help you out, change the garment and pads and whatever else you need help with. Let's see. So Nevada is your only location. Yes. If you're out of state, how many follow-ups? We don't require that you come in for follow-ups. The procedure is a very simple procedure. It's easy. The recovery is I'm not going to say easy, but it's uneventful for the most part, in necessity for visits. The big concern would be for an infection, but everybody gets antibiotics, so my infection rate is less than 0.1, so like 1 in 1,000 people will get an infection. Um, you know, Other than that, there's very few things that need to be seen. If you do have something you're concerned about, you want me to see, just take a picture. Nowadays it's technology is freaking awesome, right? So you can just take a picture and email or text it to me. I mean, it's that easy. And like worst case scenario, call me up. And even that, if you want even more, then let's do a FaceTime so I can see while we're talking. And I mean, like, technology is freaking awesome. You don't have to be here anymore. And so that's really what's changed these procedures. It's just not that difficult. So you can fly in from out of state, get these procedures, fly out, and I mean, we just don't have problems, which is kind of cool. I mean, every once in a while you're going to have some small issues, but it really hasn't been. We really haven't had any big problems. Tukey, you're asking about payment plans. So we have a couple options. There's a financing company that we deal with, so you can finance if you want to do that. We also have, it's kind of like a layaway type program where you can make payments prior to the procedure, and when you're paid in full, then you can go ahead and move forward with the procedure. If I do the fat transfer to my buttocks after the recovery workout, will I lose the fat transfer? So Bennett, this is a good question. When you do fat transfer to the butt, will you lose the fat afterwards if you diet and exercise? So once we transfer the fat to wherever we transfer, whether it's your face, your hands, your boobs, your butt, whatever, wherever we transfer it to, your body accepts it as yours. So it is your fat now. And it's going to act and respond just like any other fat that you have on your body. So if you lose a substantial amount of weight, the fat on your butt will change, just as the fat in your belly, just as the fat in your breast, the fat in your arms. It'll change the same way, because when we lose weight proportionally through all the fat cells on our entire body. Now, the interesting thing here is that with the fat transfer, we put more fat cells in a specific area. So now you have a accumulation of fat cells. Well, most people consider this your trouble area, your problem area. But now you actually want the fat on your butt. So it's going to be harder to lose the fat on your butt because you have an abundance of volume on the butt of fat. So with the same respect, it'll be difficult to lose. because you have more fat cells, and then as soon as you start gaining weight, those fat cells will swell up. So it'll be easier to gain weight in the area that we do the fat transfer. So, um, you know, it's good and bad, but it is your fat, so it's going to respond just as normal fat would. Clarissa, you do not have to lose weight. We don't have any restrictions for weight loss. You don't have to be your perfect weight for liposuction. We don't have any restrictions for BMI. Come as you are. If you have fat, we will suck it off. And Sarah, we are not in Texas. I know everything's big in Texas. I should be there. No, but you know, we get lots of, we just had a patient today from Texas, El Paso. We had one from Kansas. We had one from, I believe, was Chicago. So they come from all over the place. Every day, yeah, I would say at least 3 out of our 4 patients are from out of state. Okay. Let's see. All you heavier individuals, I see a couple people putting their weight here. It doesn't phase me. I suck a lot of fat out of people. I'm really aggressive. So large individuals, you don't scare me. I'm gonna make you skinny. So just go ahead and get your consultation. Let's get this done. If you, Diana Wilson, if you had lap band, it's not a big deal. We can still work with you. Let's see. You guys see any other questions I'm missing? I see a lot of the repeat questions. We don't offer care credit, but we do have a finance program, as I mentioned.
On Instagram, it says, I know the person is awake. How do you numb the area?
Okay, so the numbing process is called the tumescent technique, and so we're going to use a small instrumentation that's passed underneath the skin, and it's attached to a pump, so it pumps the fluid in. So it pumps the fluid into the fat layer, and it swells it up. And the fluid consists of lidocaine, saline, and epinephrine. The lidocaine is the numbing medication. Epinephrine constricts the blood vessels, so it makes it so there's very little bleeding during the procedure. So that's the process of getting you numb. So once you're numb, we can literally remove the fat while you're awake, and you're sitting there talking, laughing, on your phone, live on your phone, and we've had patients doing all kinds of stuff. Let's see, what if you're hard to numb? Just like going to the dentist, sometimes there are people that the numbing medication doesn't work as well. So our alternatives are we use more numbing medication, but we also like say for example if we're doing the procedure and you're numb in most areas, but then you have an area where you still feel some stuff, so I'll go back in there and put some more numbing medication in there. Alternatively, we do have narcotic pain medication. I really try to push away from that because there's lots of side effects, but that is an option.
How much blood is lost during the procedure?
Everyone's different, but very, very little. If you look back on some of our pictures of people holding their fat, you can see that the fat itself is yellow. When there's any blood in there, the blood will dye the fat, and it'll change it to more of like an orangish, reddish color, depending on how much blood is in there. There's always going to be some blood that's expected, and typically the blood will mix with the fluids as well. So at the end of these procedures, you can see there'll be like some fluid at the bottom mixed with a little bit of blood, but it's kind of deceptive on how much the actual volume is. So first of all, there's very little blood loss, and that's because of the epinephrine, which is the adrenaline that we use. It constricts the blood vessels, so essentially all the blood moves away from the area. You may have seen some pictures or video where the skin looks really white just in the area that we're treating. And that's just because all the blood has been pushed away from the area and is no longer underneath the skin. So when we suck the fat out, there's no blood there. All the blood's gone. So we have very little blood loss during the procedure. I would say, if you need a number, probably a few teaspoons. Now, you got to keep in mind that when you see blood, like when it drains out, the fluid, when you get a couple drops of blood, will look red. So it's deceptive, and it may seem like a lot more blood is coming out than actually is, but there's very little blood loss during this procedure, which is good. And that's been one of the major changes of the procedure over the past decades. Let's see. Casey says, "How do you get those stomachs that are hanging to snap back?" So typically, and you can see this picture right above me here, this belly was hanging. Well, it hangs because you have large volume that gravity is pulling down on. That's why the belly hangs. Also, there's going to be some degree of looseness of the skin, so you'll have some excess skin. So without seeing you, I don't know, how much or whatever the case for you in particular, but I can tell you that once you take that volume, that weight, that fat that's pulling down on the skin and causing the fold, once you get that out of there, it always bounces back every single time. The question is how well. I'm very, very aggressive, particularly at the fat at the lower part of the belly where it folds, because nobody likes that and everybody wants that to go away. So I'm very, very aggressive there. On most people, it goes away. I'm talking like even the people that's folded over like 4 or 5 inches, it'll retract back quite nicely. So if you have that, you're concerned about that, you've been told you need a tummy tuck, it's bullshit. You don't necessarily need it. You can still get great results with just liposuction. And go back to our website. You can another picture right above here that she would have been recommended for tummy tuck. This is arms. You can see how well that skin retracts back. So this is a 55-year-old female. Her arms had looser, thinner skin. They were hanging down, and it retracts back quite nicely. So if you're concerned about it, I'm telling you, the results are great. You got do your research, but check out our pictures. We get phenomenal results, and don't, when people tell you that it's not possible, don't believe them. It's just because someone says something doesn't necessarily mean it's true. Let's see. Let's see. So Mariah asks, how long do you have to wait after having a baby? The standard recommendations are 6 months after pregnancy. Tracy says, I had 6 boys and would love a total makeover. Well, we can hook you up, Tracy. For people like you, typically you're going to have looseness of the skin, so I recommend the Smart Lipo for the skin tightening. It's a laser. The laser is something that we pass underneath the skin, and it heats up the undersurface of the skin, causing a contraction. And it's been shown through studies that it stimulates collagen growth for about 6 months after the procedure. So as you're healing, you continue to get thicker and tighter skin with a maximum benefit of about 6 months. You also, the studies have shown that you can get about 57% more skin tightening when you use a laser versus liposuction alone. So obviously if you've had 6 boys, you stretch the skin out pretty well, you've damaged the skin, you probably got some stretch marks, probably got some thin, loose, hanging skin. So we can help you out, absolutely. Just depends on what your expectations are. Okay. Trying to convince my friend to come with me, and we can both get it done. Carmen, we get a lot of people that do that. In fact, I've had a lot of couples that for their anniversary they'll come get liposuction together, and that's kind of cool. But I gotta be honest with you. If your friends are anything like my friends, they don't do anything. it's like pulling teeth for them to move and take any action. So most people don't take action. So trying to convince your friend to do something, you may be waiting forever. So if you want to do this, then do it. Stop waiting for anybody. Stop waiting for anything. Just get over it. Just let go of those things that you're holding on to that are stopping you. Just let go of it. Let go of the fact that your friend's being a pain in the butt and not calling you back or isn't scheduling or whatever. Just let it go and just move forward. Take action. Get the procedure yourself. I'm telling you, you're gonna love the results. So take action. With all the concerns of opioid addiction, you prescribe pain medication. Yes, I don't like I am not an advocate of pain medication. We actually use only Tylenol with codeine. This is Tylenol number 3, which is not a strong opiate, although it is an opiate. So I'm not an advocate of opiates. I personally wouldn't use them, and I wouldn't recommend my family using them. But we have them available if you choose to do so. So it's your choice. It's available. Do you have to wait until you're done having babies to get liposuction? So that answer is no. You do not have to wait until you're done having babies. So most people think that you should wait, because they think that, babies are going to ruin your body. Well, that may be necessarily true, but all the studies that I've read say that fat cells don't reproduce. So once we remove those fat cells, they're gone. So you don't have to worry about, getting pregnant and then those fat cells all of a sudden, coming back. It's not going to come back. I always use this example. My sister, she had liposuction on nearly her full body, and she had two babies afterwards. And she basically said that her body went back to the way it was pre-pregnancy body when she got back to her pre-pregnancy weight. So once you lose that weight and get back to your pre-pregnancy weight, the body that you have should be comparable to what it started. Um, with that said, it's still important to diet and exercise and eat right after pregnancy. It's also should be noted that through pregnancy you're going to be stretching out quickly, so you may get stretch marks. And so that none of that really has anything to do with liposuction. You would have gotten those whether you did liposuction or you didn't do liposuction. So if you want to get liposuction now, if you feel like it's the right time for you, you don't have to wait, and I think you'll tend to bounce back quicker after your pregnancy if you get the fat off of you before the pregnancy. So, and theoretically, you may, if you have less fat, you theoretically will not get as big because the fat's not there, which could lead to less stretch marks. So I haven't seen any studies on this, but I'm just talking theory here. Maybe it makes sense to you, maybe it doesn't. But it's up to you. Yeah, there's lots of questions on babies. You just ruined. Yeah, no, with the babies thing is just you don't just ruin the body after liposuction. It doesn't work that way. Your body doesn't produce more fat cells. Yes, Linda's saying you could have a healthier pregnancy. It's possible. I mean, look, anything's possible. Look, there is no right answers in life, in pretty much anything, and even like doctors that are considered experts. The truth is that look, all the stuff that I learned in school is all obsolete now. It's all changed. So what these really smart people were telling us that was right for decades, all of a sudden is wrong, and you're like, what the hell were we thinking back then? And it's simple. So and I'll give you a simple, not explanation, an example here. So I used to work in orthopedic surgery before I did this. And in orthopedic surgery, when I first got out of school, if you had a knee replacement or an ACL reconstruction or some damage to the knee that we had to do to repair surgically, those patients, the recommendation was immediately after surgery is to be immobilized for 6 weeks after the procedure. Well, as it turns out, when you immobilize someone for 6 weeks after the procedure, they get a stiff knee and they're unable to bend it. So the recommendations changed, and so now immediately after the procedure, they're moving the knee. And so it's complete opposite, being from wait 6 weeks and to move it all to moving immediately after the procedure. But the result, I mean, it's like when we look back, like, what the hell were we thinking? Why would we keep them immobile for 6 weeks? That's crazy. So the same thing has happened in medicine. There's many medications that are now obsolete or now considered bad for you. I mean, marijuana, for example. Marijuana was a class 1 drug, which was considered on the same ranks of cocaine and heroin, but yet now it's legal. And people are saying it's good for you. So, don't listen to all the things that you hear. Just because someone says that something is the way it is doesn't necessarily mean that it's true. So you have to like things have to make sense to you. You have to do your own research, and it has to make sense to you. So don't trust everything that you hear in the media, because there's a lot of fake news out there. And if you guys haven't heard that yet, you guys see any other questions?
Will I have to stay in bed after lipo?
Will I have to stay in bed after lipo? Answer is no. You're gonna actually walk out of here. You'll be doing stuff immediately, and there's no restrictions other than your own restrictions that you put on yourself. Let's see. Maria says she already had a consultation, never got a response. So look, any of these people that say that you know you're not getting responded back to from us, or you're not getting responded back quick enough, we're inundated with people contacting us, phone calls. We have messages, emails, you know, messenger on Facebook and Instagram. So like, we're inundated with people. So if we're not getting back to you quick enough, just like, if you want this, take the effort. You know, that's all I can say is if you want this bad enough, then you're gonna go through whatever effort that you need to get it done. So like, if we don't call you back, call us. If you don't get an email response, maybe something happened. You know, like, assume that something happened. And we're not, look, we want your business. We want you to schedule with us. So if we don't get back to you, there was a reason on our end that we didn't get back to you. It wasn't just because we don't like you. You know, so call us, email us, whatever you got to do. Get in touch with us. Let's make this happen for you. Let's change your life. Let's see. Janae says, I lost 140 pounds and want to know what you suggest to get rid of the fupa. Do you suggest liposuction or fat transfer? I lost some of my butt. So, you know, when you lose that much weight, Janae, there's obviously going to be issues where you have fat pockets where you had more fat cells in a particular area, which messed up your shape. So I'm assuming that you have some shape issues that we can repair. Fupa is fat from above the pubic area. That's easy. You know, suck that fat out. And then also, if you've lost that much weight, you may have lost too much weight or too much volume on areas like your breast or your butt. So if you want to take that fat from those problem areas and put it on the breast or the butt, that's typically a good solution for people like you as well. Any questions on pricing? I'm going to refer you back to the website and to get the consultation. We do charge $12.99 per area for the liposuction, so it just depends on how many areas that you need or want.
How soon can we exercise after liposuction?
How soon can we exercise after liposuction? So immediately after the procedure, you're going to be up walking, and I expect you to be up walking and moving around right after the procedure. As far as exercising, most people, about 87% of our patients, report getting back to a full gym workout within 2 weeks, but that means that there's about 13% of the people that don't get back within 2 weeks, and those people may take longer. Everyone's different. Most people do quite well with the recovery with this procedure, but there's going to be a minority, a small number of people that are unable to, unable to do what they need to do. So I'm gonna wrap this up here in a few minutes. So if you guys have any other questions, how long is the waiting list? I don't, we're not booked out that much. Remember, this is all we do, and I do a lot of these procedures, and I'm very fast. So typically, when we get booked out more than a few weeks, I'll open up another day. So I don't like to be booked out more than a few weeks. I like people to have the ability to get in quickly, because I think most people want to get in quickly. I know there's plastic surgeons that they claim to be booked out for 6 months, but the reality is they're doing procedures once a week or once every other week, and that's why they're booked out for so long. So that's crap. I would never do that. I would say the longest you're going to wait for us is a couple weeks. Is the cost per area still if you're larger, or will it cost more to remove more? So, Shell, the cost of the areas are the same. However, the size of the areas are the same as well. So if you're a larger individual, you may need more areas to cover the surface area that you have. And this is most prominent like on the front of the abdomen. So as people get larger, the belly grows out, and then gravity pulls it down. And so as it pulls it down, their abdomen stretches and it gets longer. So some people, their abdomen's hanging like halfway to their knees. So that's obviously much longer than an individual like myself. that's smaller. So typically the size of an area is about the size of a large hand. So like I go like this, so it's a large hand and it's wide. So, but there's some individuals that are like twice the width of me and twice the length, and so we have to charge appropriately for those because we need the supplies and as well as it's the time and effort that's going to take to remove that much volume. So that's how we try to price it appropriately. We try to be fair with these individuals. But with that said, I know those larger individuals are getting turned down from everywhere. So I can help you. And so that should be enough. I can help you, and I'm not gouging you. I'm like charging you ridiculous, and I'm charging you a reasonable fee for the work that I'm doing, and I can help you, and I'm going to get you in quickly. Lipo on the legs, inside or outside or both? Both. Get both inside and outside. We also do full thighs, which is when you're much larger. We do full thighs, which is like circumferential, goes all the way around the thighs. But most people will need like inner thighs, knees, and outer thighs. That'd be probably the most common with the thighs. Deborah, we have a couple contests. We have an ongoing contest for the free liposuction. It's a random drawing. We haven't announced when we're going to do the next drawing announcement, but it'll probably be after the summer when we slow down a bit. We do have a contest going on right now where when you place your deposit, it enters you into this contest, and you'll be eligible to win 3 areas of free liposuction. So we're encouraging people to place their deposit. So it does mean that you're spending money, and it does mean that if you don't win, you're going to get your procedure, and you're going to be paying for your procedure. So, but with that said, it substantially increases your odds of winning. Because instead of having 100,000 people to choose from, we're going to be choosing from about 70 or 80 people. So you'll have a much higher chance. So if you want a good potential of winning, I would get entered into this contest now. We'll be announcing the winner. Is it July 1st? Is that what we've been saying? So July 1st, or right around the first part of July, we'll announce the winner, and that'll be everybody who has placed their deposit or has had the procedure in the past 3 months. So that's the contest we're doing right now. Okay, why don't you recommend a tummy tuck? I have a horrible scar. I think you just answered my question. So I don't do tummy tucks because the scars are terrible and most people hate them. With that said, if I did tummy tucks, I am phenomenal at sewing, and I would have given you a much better scar. So I'm sorry that I don't do them, but I don't because I don't like doing them. I don't like the big scars. Most of my patients are trying to avoid the tummy tucks. I think they're terrible procedures. The results are not good as far as the recovery. It's very challenging, very difficult. A lot of times they sew everything too tight, so you can't actually stand up straight. So imagine you're trying to stand up and you're tearing your skin because they didn't leave you enough skin to actually move. So that's actually very common. The other thing that's common is when they cut away the skin, they tend to get pouches on the side here. So instead of getting the nice hourglass figure that I like to create, they get a pouching out. And it's called a dog ear deformity, and it's very, very common. So that's most of the reasons why I don't like the tummy tuck. Plus, it's got to be done under general anesthesia. They typically don't do enough liposuction during the tummy tuck to get the better results. So I suggest getting liposuction first, get the fat sucked out, get the nice waistline first, and then if you still feel after liposuction that you want to get a tummy tuck, you can always get a tummy tuck later. Okay. Bruising is one of those things individual. Typically most people bruising will take a week to 2 weeks to go away. So all right, that's what I wanted to know. Okay, all right, cool. I'm gonna get going, people. I appreciate you jumping on live with me here. Thank you guys for being here and listening, giving me someone to talk to. But when you guys are ready to take that next step, make sure you schedule your free consultation, and make sure you do it before the end of July and place your deposit so you can get in for this next contest. So it's you place your deposit, and you'll have a chance of winning 3 areas of free liposuction, a good chance of winning free liposuction. So, and if you've already had your procedure, we're just going to reimburse the person if they win. So that's the deal. Make sure you guys sign up for your consultation. Hope you have a great day, and I'll be back next time.